evening, everyone. Okay, let's see if we got Dr. Melanie here. Hey, Dr. Melanie, how are you? Okay, until we get her sorted out, I want to say good evening and thank you so much for joining me inside the Diana Wright Show live. Yes, there is Dr. Melanie. She's with us, and we're going to Skype her in just a few moments. But just reminding you and asking you to keep in mind what okay, she's gone. So well, I guess we'll try again. Let's see. Okay. Okay, so we are just gonna try to, get some things sorted out for you this evening, especially the big story of the day is the one with Michael Douglas. And Michael Douglas is actually saying that he thinks he got throat cancer. Okay, right there is good. Right there is good, Dr. Melanie. I'm gonna just bring you right in. You want to give me some levels before I bring you in? So, alrighty, we're going to go to Dr. Melanie right now. Bring her in. There you go. And welcome to the program. Thanks for joining us. Lots of stuff to discuss. Okay, what is that person? Okay, no, you don't need to adjust anything. You're good right now. Right there is good. Perfect. Yeah. All right. I just want to, first of all, welcome you to the program and thanks for joining us again. It's Tuesday and it's time to...
I just need a little bit more volume on your end.
On my end. Well, you should not be listening, hearing me that much through what are you hearing me through there? I am turned up just like I normally am. Can you hear me?
I can hear you better now.
Okay. I didn't really do anything, so.
Yeah.
Okay. All right. Lots of things going on this week that is kind of incredible. Michael Douglas says he thinks he got throat cancer from oral sex, and also it is something that we all know as cunnilingus. Are you aware of this story?
Can you project a little bit more? I'm still having a little bit of difficulty.
Oh, you're having difficulty hearing me? Okay.
Mm-hmm.
All right. That's kind of strange because I can't really turn myself up too much because then I'm going to get a feedback. Can you hear me now?
Yes.
Okay. All right. All right. Michael Douglas, the movie star?
Yes.
He says that he thinks, well, not think, but he knows now that he got his throat cancer from oral sex. And cunnilingus, I guess, is the word for oral sex. Am I correct?
Yes.
Okay. And they're saying that whomever he did this with must have had the HPV, the human papilloma virus. Hence, he caught it through cunnilingus. So, can you explain this? Because, okay.
HPV virus. The HPV virus 16 and 18 are associated with cervical cancer.
Uh-huh.
And so if you have someone who has the human papilloma virus resident in their body,
uh-huh.
and then they actually have, in some cases, genital warts,
right.
And somebody performs oral sex on that individual, then they are at risk for contracting an STD.
Okay.
Yes. Not only that, remember, the vaginal canal is supposed to be the cleanest area of, the body on a female.
Mm-hmm.
However, if, for example, a female has not had a pap smear recently, or maybe it's going to be their first initial pap smear, mm-hmm. and they have no idea that they are carrying this particular virus, then, they're at risk, so to speak, in terms of their sexual partner who might be performing oral sex on them. That's the reason Gardasil came out. And Gardasil is aimed at targeting that particular virus and preventing a female from contracting it. And of course, they also, made the vaccine available to little boys as well, so that they would not put their partners at risk of contracting this particular virus, which can result in cervical cancer.
Okay, so they're now saying that boys can get the Gardasil, and there's
Yes.
another one that begins with a C, another drug that the girls can get, but the boys can't get that one. But the girls do get the Gardasil. But there's been lots of bad news from the Gardasil from several parents who say their daughters took it and they came up with all these autoimmune diseases and various things. So, in my assumption, as a lay person, I believe that if young women would just stay away, abstain from having sex so early, then maybe they can save themselves. Am I correct?
Well, I mean, abstinence is your best bet no matter what. Whether you're trying to avoid getting pregnant or avoid being exposed to a potentially deadly STD in some cases, then, you know, not engaging in sexual intimacy or intercourse for that matter. Let's take away intimacy because, you know, like we have discussed before, some people believe that having oral sex does not put you at risk. Well, clearly, with our initial discussion with Michael Douglas, that is clear. That's clearly not the case. And so, you know, I want to put that out there because a lot of people believe that just being intimate in the setting of oral sex and not actually having vaginal and penile connection or penetration of the penis to the vagina, then they're not really having sex. Well, that's a misnomer by every sense of the word, and it's clear that we are still at risk no matter what.
Yes, so Michael Douglas, so is it actually a true possibility that you can indeed get some form of throat cancer or mouth cancer from performing cunnilingus?
Well,
and please, ladies and gentlemen, I'm just saying cunnilingus to be polite because it's oral sex is really what it is. It's just a fancy name for it, right? So go ahead, Doc.
Right. If someone is willing to put themselves at risk, think about it. With kissing, you can get Epstein-Barr virus.
Okay.
You know,
Why
which
am
is
I
mono.
getting that?
Then what else is out there that you're not putting yourself at risk for? So, for example, if a male has herpetic lesions that we talked about a little bit last week, or a female has herpetic lesions, which, you know, little ulcerated areas in their vaginal area or penile area, or, you know, they start out as little vesicles or little, what they look like pimples initially, and then, you know, it unroofs and it becomes an ulcer. If someone has this in their private area and you're not really paying attention because you're so in the heat of the moment and, you know, you're figuring you're monogamous with that person and that person is also monogamous with you, then you're thinking more than likely you're not really at risk. But the question arises, how many partners has that individual had before you? And if they've never had any partners prior to you, how about you? What is your personal sexual history? So at the end of the day, you still have to say, I'm at risk, no matter who the individual is. You understand what I mean? So you can't say that I'm not going to get, you know, some kind of venereal disease because I'm not having vaginal penile connection. Hello, the mouth is a cavity. And there's some people who during oral sex, because I mean you have patients that have this discussion, there's some people who with oral sex, when the male ejaculates, they actually swallow that fluid.
Yes,
so it's not like
that sperm that those women,
whatever the case might be.
Yeah.
And nobody should be grossed out by what I'm saying. Because, I mean, it's a natural part of what the idea of sex is. You want to have an orgasm, and that means a release of bodily fluids. You know what I mean? So in this case, if a male releases bodily fluids, a woman is at risk because whatever he's carrying is now being released into her body. It's just the same as if he ejaculates or comes, as some people call it, inside of her vaginal passage. It's the same risk that's posed. And so we can't take it for granted that just because people have, you know, oral sex is not a big deal. You're still at risk.
Okay, so we now learn that oral sex is sex, and you can get those diseases that you think you're only going to get from penetration through oral sex. Michael Douglas cleared that up. And as I read the story, I was kind of wondering, did he go back in history or something? And how did he figure this out? Because, at one stage he was called a sex addict when they were, everybody was saying, oh, Michael Douglas, he just loves sex and and all that kind of stuff. So I was trying to figure out, how did he come to this conclusion 3 years later after he had and treated his throat cancer? So I just thought to myself, did he keep a diary of all the people he had sex with or something?
Well, here's the thing. If you get diagnosed with certain types of STD, I mean, of course, obviously HIV, but, if you get diagnosed with certain types of STDs, such as gonorrhea, such as syphilis, such as hepatitis, these are reportable diseases to the health department. And so the health department is going to contact you, because now they need to contact all the people that potentially are at risk for whatever it is that you tested positive for. And so when he goes back into his personal diary, well, depending on his activities, and I'm not a judge, but depending on his activities, you may not always, especially if you're someone who has had multiple partners, you may not always be able to really figure out where this potentially could have come from. And don't forget, you might be with this individual, but remember that individual may have been somewhere else, and so the risk continues to grow with the number of partners as it increases.
Wow. Every time you hear something of this nature, you just wonder, one moment of pleasure can cause so much pain. Seriously. It's not just pregnancy that you have to worry about anymore. One moment of pleasure, ladies and gentlemen, listening to me, watching me from around the world and in the U.S., can just cause you so much trouble. So sex is really and truly something that we should not just play with. And we should be, I truly believe now that even in my era, if everyone had said, just wait until you get married, all of us would have done that. And, we must stress to our children at this moment, at this juncture, that we know so much more than we knew 10 years ago. Because 10 years ago, I didn't know that cunnilingus, anybody could be talking about getting cancer from having oral sex. Amazing to me when I read this. So we just have to not think of sex as this casual thing that we do. Because a lot of people, they just think, sex is just sex and I just get my groove on and move on, kind of thing. And I just think it's crazy. I really do. So, anyway, what can I say? I guess I've just been more prude than I was before. Because I've been accused of being very prude, but I just continue on my little zone that I'm in. Okay, Doc. So, no more husbands for me after this one. I truly stressed out about that thought. Just thinking about the young people, and the things that they're exposed to right about now. Anyway, another one. There was an article online about surgeries that you should avoid. I want to go through them one at a time because I was kind of surprised to see that stents was for stable angina is one of the number one surgeries that they're asking you to avoid. And they spoke about strict diet, exercise, take medication, and a stress test. Manage your cholesterol before you jump into getting stents. And over the years, you've heard every time someone has a heart attack or anything like that, they go, oh, they're putting a stent in. And everybody thought that was a wonderful thing. So why is it not so wonderful now?
Well, there are different types of stents that they can put in.
Okay.
There are some stents that they put in that they call drug-eluting stents. So certain types of stents, when, it's placed in the artery that's clogged, that patient may need lifelong Plavix, and also in many cases aspirin. And so there's some people.
We're going to get to that aspirin thing now, Doc. That's my next thing for you.
That patient to make sure that there's not a clogging or a blockage that occurs with that stent, because within the first several days, that patient is at risk of having that artery to be clogged. And in some cases, you have people that come in with, what they call unstable angina. So angina is just chest pain that's of a cardiac nature. And cardiac, of course, we're talking about the heart. So sometimes people present with chest pain, and it's nothing to do with their heart not functioning properly. So, you do an EKG, and you see that there are no acute changes on their EKG that's suggestive that their heart is ischemic or having decreased oxygenation, or that they're actually having an actual heart attack. In some cases, you might find that there's an enlargement of a particular chamber of the heart, and other, things that you might find a heart block somewhere. But in the case of angina, a physician is looking at symptoms, so the chest pain they're presenting with, the kind of associated findings. So sometimes they might complain of increased sweating. The pain radiates to their left arm. The pain feels like, there's an elephant sitting on my chest. They're short of breath with that. And other concerning signs and symptoms. And in some cases, people pass out, And so depending on what's going on with the heart, that's how the decision after multiple tests are run that they decide. Of course, if you see ST elevations, which is suggestive of an acute heart attack occurring, you're not going to sit and say, I wonder what I should do with this patient. You're going to rush them to the cath lab and make sure that you take care of what the issue is at hand. And so in terms of the stent, like I said, there's some people that unfortunately have had a blockage occur, or a blockage that reoccurs in that particular artery, and they have to go back and get that evaluated again surgically and manipulated. And so just having a stent might sound like something cute, but then there's some people, they are not compliant, or they don't follow the instructions given with regards to the antiplatelet therapy that they're supposed to be on. So let's say, for example, a patient is on aspirin and Plavix, for a duration of time. Maybe the Plavix might be for a year, or maybe the Plavix might be lifelong, plus aspirin. So if the patient is not taking either of these medications, and all of a sudden they show up again, and now they've really had damage to their heart, then that creates even more of a problem. And before you know it, in some cases, a patient who is diabetic is at a high risk of having a heart attack. And, the committee that helps guide us with regards to treating people with elevated cholesterol levels, they actually equalize or actually equate having diabetes with literally having heart disease, because the risk is so high. And so for a patient who's diabetic, they have to be even more strict in terms of their blood sugar control, because their risk of a heart attack is a lot higher.
Okay, all right. The next one is complex spinal fusion for stenosis. And they talked about to prevent motion and stop pain before having any type of back surgery, physical therapy, cortisone injections, acupuncture, medications, because they're also saying that only 5% of people who have back pain actually really require surgery. Now, this one is something I know a lot about, because I know a lot of people who've had back surgery and they end up just walking bent over all the time, and they really didn't get any better. So when I saw this, but they're stressing the fusion part of the for stenosis. Can you just simply, in layman's term, kind of tell us what stenosis is?
Okay, so when you look at the spinal column is supposed to be nice and flexible, and there's what they call a kyphosis, lordosis kind of picture to it. So when you look at your neck, it's supposed to form like a nice kind of, like your spine's supposed to do like a nice S shape to it.
Okay.
In some cases, some people's spine looks like a hook that's kind of, catching a fish, so to speak. So it's kind of curved over.
Okay.
And in that case, they talk about scoliosis. So when you have a case of spinal stenosis, that's an actual narrowing of the nice joint space that you're supposed to have. So you're supposed to have nice, spongy cartilage, in between your spaces, so that you
like
can
the one you
actually
eat in the
absorb shock.
chicken.
So shock would be not somebody throwing you down the stairs, but let's say you're in a car accident, you know, your body absorbs a certain amount of shock with an impact like that. Even if it's 5 miles an hour, that's still an impact to your body. And so if you have a stenotic spine, then it's not as flexible. So think of, instead of it being like a rubber band, it's kind of like a taut cord. And so you can't really move the spine around the way you would, you know, so their ability to bend forward might be affected, or bend backward might be affected, or going upstairs might hurt a lot more. You know, so there are different things that they present with. Well, depending on the extent of this narrowing of this joint space, surgery might be, you know, a feasible option. It doesn't mean it's curative, and I do believe that most spine surgeons will tell you this may not cure you, and you may have to have subsequent surgeries to help with your symptom control. But in many cases, it's so severe that yes, we need to intervene, and we need to intervene now. But in many, many cases, we do offer conservative treatment prior to getting that far, because you know, once you start having back pain, remember your back is responsible for holding you upright. So once your back pain starts to get even more exacerbated with movement, lifting, bending, twisting, sleeping, it's waking you up out of bed, whatever the case might be, you know, there are different things we're going to suggest. Maybe we might do warm compress, you know, so all kinds of conservative treatment, epidural injections, which is invasive. But we would do all of those things before we jump and put you on a table and cut you with a knife.
Okay, all right. My special guest inside the Diana Wright Show live tonight is none other than Dr. Melanie Simpson. She's a general practitioner. She joins us every Tuesday. And we're getting down to some serious questions this week. And if you'd like to be part of the conversation, you can join the conversation by giving us a call at 561-228-1921. That's 561-228-1921. This is the Diana Wright Show live. And again, we welcome you from around the world and in the U.S. Okay, the next one here, Doc, is hysterectomy for uterine fibroids. 600,000 American women have hysterectomies or removal of their uterus. Studies show that the vast majority are unnecessary. Options include uterine artery embolization, okay, and focused ultrasound. Not quite understanding those. I'm sure you'll explain.
Okay, so when a woman presents with a uterine fibroid, which I know we talked about in
a couple of shows,
many
yes.
weeks ago, the thing that we have to remember is fibroids are benign. Keywords, they're not cancer. They're benign growths that occur in the uterine wall. Sometimes they're outside the uterus, but at any case, they're still benign. So they're not cancer.
Okay.
So that's number one.
So let's get that
Number
on the table
two,
here. Yes.
Depending on the size of the fibroid and the number of fibroids that might be seen, and depending on the symptomatology of the woman. So if, let's say, you're having heavy menstrual periods, that's one of the big signs in many cases that women have fibroids, or, you know, that would have you go searching for the potential that a woman has fibroids. So in this case, a woman presents and she is bleeding profusely. I mean, rather than having a cycle for, let's say, 5 to 7 days, she's having a cycle for 2 weeks. And she's going through supersized maxis, you know, every hour. And so within less than a day or 2 days, she's completely done with, you know, a 16 count or a 24 count in 3 days. I mean, there's some women who use tampons and pads, and they're soaking right through.
Right.
So when you have a case that's severe like that, the thing you worry about is this patient can become severely anemic. And anemia can cause them to pass out, you know, become very weak, you know, and in many cases, just not function well. And so because of all these increased risks as far as acute blood loss, and of course, the other thing is, imagine you're losing that much blood, you present to the hospital, and now they have to give you a blood transfusion. You know what I mean? So there are many, and then with some people getting a blood transfusion, they have an acute reaction to that. So some cases they might have fever, you know, and other things that we have to think about.
Right.
So the long and short of it is, depending on the size of the fibroid, depending on the symptoms that you present with. So I have a personal friend who had fibroids, that, they described it as twins in her belly. Like
Twins. Oh my goodness, twins.
What it did was it elevated her stomach so much and caused her to be so bloated that it was pressing on her diaphragm. Well, if we all remember, the diaphragm helps you to breathe. You know what I mean? And so her diaphragm was not able to expand in a normal fashion, and that caused her to have shortness of breath. In addition to that, she developed what they call an ileus, because her stomach got so distended after a while that she had an obstruction in her belly, so she could not eat, and she would, just be vomiting.
Wow.
And so, depending on the symptoms the woman presents with, depending on the fibroid sizes, different treatments can be recommended. So one of the treatments, of course, last case scenario is a myomectomy, which is the surgery that we do to remove fibroids. Or worst case scenario, last resort would be a complete hysterectomy. But of course, you have to look into, does this woman ever desire to have children again, or have they not reproduced yet and they would like to reproduce? Well, if they would like to reproduce, you don't want to take out all their body parts that are necessary for that to happen.
So we take out all their body parts.
So uterine artery ablation is also therapy that can be done. So we basically disconnect, if you will, or diminish the blood supply to feeding the uterus where the fibroid is going to grow. You understand what I'm saying? And so that's also an option as well. And in some cases, they give women birth control sometimes to try to see if that will also cause shrinking of the fibroid. The more estrogen you have, the bigger the fibroid will grow.
So what is the focused ultrasound, which they're also recommending?
So in many cases, they'll do a focused ultrasound to that area because you want to target that particular fibroid. And in many cases, they'll inject into, a particular chemical into that fibroid in attempts to shrink it.
Okay,
So
great.
you're trying really hard not to get to the worst case scenario, which is a patient having to go through a surgical procedure, because surgery comes with complications in some cases.
And the artery embolization?
Yes,
What's that?
That's basically cutting off the blood supply to that area.
All right. Okay. Wonderful. So we got that. The final one is knee arthroscopy for osteoarthritis, which a lot of people, athletes, elderly do have. They're saying that that's an unnecessary one. The option is exercise, medication, cortisone injections again, physical therapy, medical therapy. They're also saying that 178 patients actually had this surgery, and when they checked it, the people who did all these other things, they had the same results. So why put yourself through that major surgery? What's your thoughts on that one?
So with osteoarthritis, one of the big causes of that is usually people that are pretty obese, because you're putting a lot of pressure on that large joint, which is your knee, and also on your hip, and of course on your back. And so your knee takes the brunt of your weight in addition to your hips. And so we can only imagine that the wear and tear of the constant use of this joint, which is very necessary, because you walk, you use your knees to walk. So the wear and tear of this particular joint allows it to, not be as strong for many people over time. And so in a lot of cases, that chondroitin fluid that's in that knee that helps again to absorb shock if there's trauma to the knee, that in many cases and glucosamine are decreased. And so sometimes we'll recommend over-the-counter medications that provide this to kind of increase the amount of fluid in your knee. So let's say you're an athlete, you're a basketball player, let's say you're the Miami Heat. I don't know, you're one of the members. Of course, we're excited because they won.
Hey, LeBron, how are you?
Sorry, I was
Doc
just giving
says
a
to
small
say
shout.
hello.
No credit here. But, just to say, if you're a basketball player, for example, your knees are very important to you for jumping, for running, for doing everything that you need to do.
Right.
And so in a lot of cases, a lot of these athletes actually experience severe pain because they may have torn a ligament, whether it's the medial collateral ligament or it's lateral collateral ligament. So medial, of course, towards the middle, and then lateral on the side
Right.
of the knee. Or they might have torn their ACL. And once you get an ACL tear, there are other ligaments that are torn with that, so that's an automatic repair. That's not
Ouch.
arthroscopy.
That sounds painful.
Exactly. And so diet and exercise, that's important, because if you think about it, any muscle group, the only way to strengthen it is by exercising.
Yes.
You know, once you stop using it, you do what? Lose it.
Lose it.
And so, exactly. And so, depending on your regimen in terms of exercise, so for some people, that means running up the stairs, running down the stairs. Well, that also puts pressure on your knee going up and down the stairs. And sometimes you'll hear people say, "Oh, I hear my knee clicking and popping as I'm going up the stairs or down the stairs." Well, there's definitely something going on. In many cases, the amount of joint fluid in your knee has decreased. You know what I mean? And so sometimes that's why they recommend arthroscopic evaluation. You know, and they often tell you after having an arthroscopic knee evaluation done that, guess what, you're probably going to need a second one, and worst case scenario, you might actually need the knee replacement.
Ah, okay. Ouch. So if you're having any of those problems, you might just want to call Dr. Melanie. Anyway, my special guest, Dr. Melanie Simpson, she's here with us on Tuesdays, and we talk about everything, you know, ranging the gamut. Since she's a general practitioner, she can answer all the questions for us. If you would like to be part of the conversation, you can join us and just give us a call at 561-228-1921. That's 561-228-1921. I'm going to shift over to aspirin. You mentioned aspirin quite a few times. And I've heard actually a doctor that was on Fareed Zakaria's show a couple of Sundays back, and he said everyone should be taking an aspirin daily, the low dosage. And then my good friend Dak sent me this thing here today, and because I always wondered about aspirin. At one stage they say, oh, young people shouldn't be taking aspirin. Then, you know, it's okay, but you have to take it with food. And some people get their stomach gets, you know, all tangled if they just take it without food. And then you see all these ads on television now that's running that talks about, oh, I was getting a heart attack, and the first thing they gave me is an aspirin bear, aspirin, da 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 da. So now we see that aspirin consists of a chemical that is called acetyl salicylic acid. Okay. And we're also told that aspirin is not necessarily good for everyone because it could cause things like gastric ulcer, hearing loss, tinnitus, cerebral bleeding, influenza mortality, Rye syndrome, which we hear about. I didn't even know that aspirin would ever have anything to do with this. Crohn's disease. And what's this one now? I've never heard of this one. It's Helicobacter pylori infection. What on earth is that, please?
Okay, so I guess
let's start with the one. Yes, the one that nobody, I don't think anyone has ever heard of that one.
Oh, H. pylori. That's the cheap name for it, so to speak.
What is
the
it?
easier name is H. pylori, but it's Helicobacter pylori.
Oh, okay. And what exactly
bacteria,
is that?
Yes, that particular bacteria we would test for if someone presents with GI.
Oh, okay, we're losing your sound there, Doc. Yes, we're losing your sound, and we lost you too. So we're going to go to just me for a minute, and then we'll come back. Okay, are you back? Yes, there you go. Okay, Doc is back. Go ahead, Doc.
Okay, so with H. pylori, one of the things that's very important is, you know, to make sure, I want to make sure that my sound is better?
Yes, you're good. Uh-huh.
Okay. All right. So one of the things that's important with H. pylori is whenever you suspect that someone may potentially have an ulcer, you want to test for that bacteria because that's the most commonly associated bacteria with a GI ulcer. And so if you think about somebody who's on aspirin and they have an ulcer, well, the only thing that they're going to be at increased risk for is bleeding from that ulcer because aspirin causes irreversible platelet damage. So platelets are nice little building blocks I call them, that hang out in your body. And whenever you get a cut, they actually initiate or stimulate a cascade, the clotting cascade, to take place. And when that occurs, it forms fibrin, which is like a mesh, that forms a clot over an area where there was previously bleeding. So it's basically there to allow you not to bleed out.
Okay.
So if someone has an aspirin allergy, then of course giving them aspirin or recommending them to take aspirin makes no sense.
Okay.
Number two, if you think about people with hypersensitivity reactions, so, people with asthma, sometimes, they have sensitivity to aspirin, they may not necessarily be people that you would recommend that to either. If somebody has a hemorrhagic stroke in their history, so in other words, they had a brain bleed in their history, well, giving them something that's going to cause them to bleed even more is not a good idea.
Okay.
So that's something else to consider. And then when you think about, like we talked about previously, with someone getting a cardiac stent or a heart stent, then, depending on that person's history and their risk factors, the doctor may say, okay, we can put you on aspirin as opposed to putting you on, some other drug, in order to make sure that you don't get a repeat episode of this situation. And so there are many factors that you have to consider. A diabetic female over the age of 35 years old, it's recommended that she be on aspirin, kind of prophylactically, in other words, to prevent her getting a heart attack. Well, if she has other risk factors that would prevent her from safely taking aspirin, then she would not be recommended to be on aspirin. Like you said, aspirin can cause hearing loss in some people, and a lot of people complain of ringing in their ears with taking aspirin. So no, they're not in the ocean, no, they're not listening to seashells, but all of a sudden their ears are ringing and they can't understand why. And when you go back and visit their medication profile, the newest drug added was aspirin, and so you can kind of get an idea where that arose from.
Okay,
and
so is tinnitus
children? You have to be careful with giving children aspirin. Moms, it's recommended that you give children Tylenol or Motrin, depending on their age, and not aspirin, because a lot of people tend to think, I have a headache, so let me pull an aspirin out the cabinet and take it. I had one patient that I encountered, I'm going back to the Reye syndrome in a second, but I had one patient that I encountered that was taking 12 aspirins a day for headaches.
What?
And I'm not talking about baby aspirin, which is 81 milligrams. They were taking 325 milligrams of aspirin 12 times in one day.
Wow.
And that alone can not only tear up your GI system, but that can put you at risk for so many other complications. Yes, when you do have a heart attack, we do give aspirin to the patient as long as there's no contraindication or no risk factors that would prevent that from being a safe option. With regards to Reye syndrome, children can go into liver dysfunction because of getting aspirin. So that's kind of what the concern is with regards to giving children aspirin. And so as you can see by the small list that I kind of compiled, you have to be very careful. Not everything that's good for the goose is necessarily good for the gander. So not because, a lot of people come to me and they say, well, Dr. Oz said this and Dr. Oz said that. And the other day, Dr. Oz had on his show, it's kind of like a little commercial break where he said, companies are contacting you trying to sell you products, and I did not have anything to do with these companies. You know what I mean? So he's saying, hello, be wise. You can hear the information, contact your local physician, and get some better advice, or ask them the question, is this safe for me to pursue this particular thing that was recommended by Dr. Oz, or by Dr. Mellon or any other practitioner? Because we don't always have all the answers, you know what I mean? And sometimes that's why we have specialists, especially for us as, primary care physicians. That's why they're specialists. I don't know everything about the heart. That's the reason I contact a cardiologist. So with regards to aspirin, I would recommend that you pry a little bit more into your history and make sure that you don't have any risk factors that are going to be contraindicated to you consuming aspirin.
Okay. Tinnitus, is that ringing in the air? Is that what that is?
Tinnitus,
what is tinnitus? Okay, that's what that is. Okay. All right. I just wanted to make sure. So the bleeding and the influenza mortality, the Reye syndrome, Crohn's disease, it is all actually true that you can indeed get these things as a side effect of taking too much aspirin.
Yes.
Okay, so the person you mentioned about the aspirin that they took, which was the full-blown milligrams, as opposed to the 81, yes, which is, they call it the baby aspirin. I don't know why. Are they calling it baby aspirin because you can give it to babies, or are they just calling it baby aspirin?
I think it's just the dosage. I think the dosage is the reason that they gave it that name. I don't know if you want to call 325 the adult aspirin. I don't know.
Yeah, because I wondered about that myself, because I thought, okay, what's the difference for me taking the baby one and the big one? The big one I do know, for me, I just can't take it. But if I take the baby aspirin, there's a coating on it, I think, that makes it different. And it's easier to go down.
I was just going to say that not everyone takes enteric-coated aspirin. So for someone who has a history of GI bleed and they must be on aspirin, you can give enteric-coated aspirin, which is not really going to increase their risk of bleeding. So that, that type of aspirin is available to those patients, or patients who have extreme sensitivity with taking aspirin. From a GI perspective, you can give them enteric-coated aspirin, to prevent them having, GI issues with, taking that particular drug. So, yes.
Okay. All right. Okay, let's get to some other questions that are not so medically technical. Okay, let's start here. How do I decide which birth control method is right for me? That's a question that came in.
Okay. Well, number one, hopefully you either have a primary care physician or a gynecologist of your own, or, you're recommended by a friend. However, one of the considerations you have to think about is, do you want this to be long-term birth control? And when I say long-term birth control, this doesn't mean you start at 20 and you end when menopause occurs, But in terms of long-term, you have to decide how long do you desire to be on birth control? What is the reasoning behind it? Is it for regulation of your periods? Some people are concerned about weight gain with taking, birth control. And so you might come and say, well, I want the Depo shot because I'm not really going to gain as much weight compared to if I take oral contraceptives. And then another person might say, well, I don't want to be bothered with all the pills because I'm not going to remember to take them anyway, and that's going to put me in trouble. How about I just get a patch? And so if you're someone that's obese, for example, the absorption rate with the patch is not the greatest. And so you might not be getting active, effective birth control with using the patch. So we may recommend you actually take pills. Or the other thing is you can do an IUD as well. So there's the Mirena IUD, which is 5 years long. So if you decide you don't want to have babies, and hopefully I'm talking to adult responsible people, if I'm talking to children, and when I say children, there are 11-year-olds,
teenagers,
started having 9-year-olds, 10-year-olds, and the mother might bring them in. I've had many cases like that, where mom brings the child in and says, I want her to be on birth control. And when you say to the child, you understand what that is? Well, I don't know. She just says I need to do it, and she's my mother, so, But I don't think you should force issues like that on children who have no understanding. Mothers, I'm speaking to you. That's not wise, because for some of these children, they're saying, oh, this is a meal ticket to go and have sex, and now I don't have to worry about it because I'm on contraception. Well, hello, contraception does not prevent STDs unless you're using a condom, which is not always 100% effective anyway.
Right.
So, these are factors you have to take into consideration. The other thing is this person a smoker? Because if this person is a smoker, that's an increased risk factor that you have to consider as well with prescribing birth control to this person. Is there a family history of cervical cancer, uterine cancer, breast cancer? These are all issues that need to be addressed before you start someone on birth control. Is there a history of migraines? Is there a history of, blood clots in the legs, DVTs, deep vein thrombosis? So all of these factors are all things that come into play when you think about birth control, period. And then when you think about the different kinds of birth control, it's all about preference in addition, it's all about how compliant is this patient going to be. So if you're someone that's not going to remember to take your pill, well, maybe the pill is not for you.
Right.
If you're somebody who does not want to really have periods, maybe Seasonique is for you. So every 4 times a year, so to speak, you'll have a cycle. But you need to shed the lining of the uterus at least 4 times a year.
Okay.
It really should be every month, but worst case scenario, it should be at least 4 times a year. So there are multiple options out there. But if you have a copper allergy, ProGuard is probably not for you, which is also an IUD. So there are many things that you have to consider with regards to that.
Yes, and you mentioned the young ones, because I noticed that they're saying that the HPV vaccine should be given to 11-year-olds.
Yes, 9 to 11 years.
Yeah,
Yes.
9 years old. Wow. Anyway,
Times have changed.
yeah, I'm not going to get into the morality of the whole thing, but just 9-year-old, no. That's just too young. I'm sorry. It's too young to be giving a 9-year-old an HPV vaccine. They shouldn't even be thinking about sex, much less having sex. Okay? So that's just my declaration on that. Anyway, is there anything I can do to make my vagina tighter? We have heard a lot about people going for surgery to make them become virgins again, which I just think is a crazy thought, because once you've given it up, you're not a virgin anymore. Yeah, you can abstain from sex for a while after that, and then you become someone who has not engaged sexually, yes. But is this factual, or are these women giving away their money, basically, is what I'm asking.
Well, one of the things I would say with regards to the tightness or elasticity of the vaginal wall itself, if you have multiple partners, for example, then you can't expect that your vaginal wall is going to be as tight as if you did not have multiple partners.
Okay.
And then the other thing about it is a lot of women don't really exercise, and doing Kegel exercises, as they call them. Some say Kegel, some say Kegel. But usually after having a baby, you know, there's laxity or looseness that occurs to the vaginal canal because, hello, you had to push a baby's head out. And so it's not as nice and tight as it was previously. So to get back into that space or into that, you know, tightness or contraction that it had previously, they would recommend Kegel exercises. And that's almost like just squatting.
Is that...
You can get with intimacy too, with sex. You can get Kegel exercises done as well. But we're talking about not having anything inserted into the vaginal area for a period of time. Let it breathe. Take a chill pill. You know what I mean? Just like you said, take some time off. And usually taking time off or taking time away from being intimate, usually you can notice the difference when you do engage in sexual intimacy again. So, you know, there are a lot of women out there that have had multiple children. The more children you have, the less elastic.
The bigger that is going to get.
Yeah.
That's basically what it is. And if you have a C-section, you're not affected because you didn't have any babies down there. So, you know, if you have a C-section, you just opt to stay tight. and not a lot of sex partners, okay? All right, okay, good. That was very good. So the surgery, is a surgery something that really works, or is it just a fantasy?
I don't necessarily think it's a fantasy, but again, surgery is invasive.
Okay.
So the option of staying away from sexual intimacy for a little while compared to going under the knife and something adverse happens, you know, you have to do the risk and benefits ratio and see, is it really worth going through all of that?
Okay, I want to come back to the exercises of the vagina again, because is that the one you're talking about where you can sit on the toilet and when you're peeing, you actually hold your pee and hold your breath for a little bit and then extend the pee again? And is that what you're talking about?
You can do that, but if I have to go, I just have to go. So I don't necessarily know that I'd be thinking about that during that time. But I understand where you're coming from. But the levator ani muscle is what you're trying to strengthen.
And I'm sitting here and I'm going in and out using my muscles there. So that is something that women can do without anyone knowing that they're actually doing that.
Right.
Okay, and
Except if you're in the bathroom in a public place, that might be quite interesting.
Okay, but you can sit down and do it. It's easy to do, women, and it actually works anyway.
Yes.
So, yes, it does. Not just me saying that, the doctor confirmed. Okay, here's a question. There's usually more pain than pleasure when I have sex. What's wrong with me?
Well, dyspareunia is what, that's called, which is painful intercourse. So that could occur either on penetration or actually when they're engaging in sexual intimacy, or right when the male is about to pull out, so to speak. But one of the concerns there is a woman may have endometriosis, and that in general causes her discomfort, period. Or in some cases, there's what they call vaginismus that we spoke about before, where the woman is not really allowing the male to really even enter the vaginal canal. So he may be trying to penetrate, but it doesn't really happen because of whatever psychological things are going on with her. And then you have some women, they might have, herpetic virus and have lesions and not know it. And so sex for them is very painful. In some cases, some people might have a urinary tract infection. And so the urethra is very sensitive, and they may be having pain as a result of that. Or, worst case scenario, and the most common even, is vaginal dryness. So you're not lubricated adequately, and because of that, intimacy becomes very painful. Because remember, when the penis penetrates the vagina, you're creating friction. So if there's no lubrication there, then that's actually going to make it very discomforting to have sexual intercourse with that individual.
Okay, I think we have a question. Good evening. You're on the air with Dr. Melanie and Diana Wright.
Hello, I have a question for the doctor.
Okay, go ahead.
I need to know if this is a myth or it's a fact. I understood that the vagina is only 7 inches, 8 inches deep to the cervix. I'm not sure. So I want to know, and some people said, it's deeper than that. I need to find out if that's true, or and in that I mean every female.
Oh, all females, you figure?
Yes.
I hope that's not true, because I'm sure that every female does not have the same size with JJ.
Well, no, size in width is different. In elasticity, as she was talking about, that's totally different. I'm talking about
the depth.
Yes.
Okay, the depth. Okay, I've never even thought about that one. Okay,
So
all right.
talking about the caller is talking about the actual.
Okay, thank you so much for calling. Okay, Dr. Melanie, the depth of the vajayjay. I've never even thought about that one. That's a great question.
Yeah. So just like the cervix, can expand 10 centimeters for a baby's head, the vaginal canal extends too. However, like she said, it's only a certain level deep.
Okay,
And
so is 7 inches what we kind of know it is, or is that just a number that someone came up with?
That's a good rough number.
Okay.
But when you think about it, if you have, for example, if a woman has a small vagina and there's a male that's very, very large in terms of his penis, and he aims to penetrate that vagina, that can cause severe discomfort. Not only that, that can cause lacerations or tears to actually occur to the vagina. And so sometimes some women don't think about it, and we've had patients come in that have vaginal lacerations, and we're trying to figure out, okay, what kind of sex were you having while there's tears in your vagina? Because people do what
crazy things.
Sex. So depending on what people are doing and what they're engaging in, they might have unfortunate traumatic experiences, even though they consider it to be pleasurable. And so there are women that have come in that have gotten, vaginal tears because, number one, they weren't appropriately lubricated, and number two, they had a very large penis that was aiming to penetrate the vaginal canal. And so that created a problem for them, and they ended up getting a tear.
Okay, I'm trying to figure out, as she mentioned 7 inches, I'm trying to figure if someone that's really short could have the same depth of a vagina like someone who is 6 feet tall.
Well, it just depends on how your body is made up. Everybody does not fit the general bill. And so, let's say, for example, if a male is a particular, let's just hypothetically say he's 5 inches, 6 inches long, whatever the case might be.
Well, only in the Congo they have 7 inches, so we just need to know that.
Well, there you go. So, if you have a woman whose vaginal canal is 7 inches, then his 7 inches might be okay. But here's the other thing. What about the diameter of the space that he's trying to enter? So you might have the depth, but you may not necessarily have the appropriate diameter for that. And even though, because remember, the labia swells and fills up with blood, right? And the vaginal area becomes very flushed, becomes very filled up with blood as well. And that's where all the stimulation and the excitement happens as you're getting more and more passionate in the act. And then with the male, remember, his penis is enlarging in size, but it's also it's also getting longer as he's more and more stimulated. And like we talked about last week, his penis actually assumes a curve the more stimulated he becomes. So now you're dealing with the penis being curved, the penis being longer, the diameter being wider than what you expected. And so you have a lot of factors that you have to consider that can make sexual intimacy not as exciting as you anticipated it would be because of all these other factors, that surround this experience.
So there are actually women who do have painful sex, basically, is what it is. All right.
Say that one more time?
No, I was just saying that it's obvious that some women have pain when they have sex based on these questions.
Right.
All right. I heard that I've heard this since I was a youngster, and I can't believe adults are asking this question still. I heard that if I douche right after having sex, it prevents me from getting pregnant. Is that true? I'm going to let Dr. Melanie answer because...
And they read this in which book?
No, these are some questions that I took offline to ask you that women are asking.
Okay.
Yes.
Okay. No, I'm just smiling. I'm chuckling at that one.
Yes, I just thought that one was crazy when I saw it on there.
I'm not going to say the individual is crazy because we all have our opinions and we're kind of all entitled to whatever we think based on our interpretation.
No. The person wants to know. No. The person wants to ask you, is this true? Please.
Right. And so going back to answering that question, if the sperm has been released into your vaginal canal and is already starting its swim over the next 24 hours, it needs to end up somewhere, So if it's on its journey up towards your eggs, you can douche from now until next week. It's already taken its flight and it's already heading for its final destination. And so in terms of preventing, how last week we were talking about that person who was allergic to their husband.
To their husband's
in
sperm,
terms of preventing bacterial vaginosis or, some other concern like that or yeast infection, douching is fine.
Okay.
However, it's not recommended that you continually douche because, again, you change the pH of the vagina. There's some women who douche with just using water, and there's some women who do vinegar, and vinegar is acidic. You know what I mean? And then there's women who do summer's eve and, everything else like that.
Right.
And so depending on the extent of the intimacy, you may actually already be on your way to conceiving.
Okay. All righty. Here we go now. What can we do about premature ejaculation? Is there something we can do about that?
There's some medications that do cause premature ejaculations. There's especially antidepressants are associated with that. And there are some medications that, we offer to some males that can help to hopefully prevent that from occurring. In many cases, there are some men they're way over the top excited before they even get started, and it's over before it starts.
Okay,
You know
so
what I
that's
mean?
anxiety.
Yes. So in some cases, it's based on that, but in many cases, the majority of them are because of medications.
Okay. Someone's asking, what if your husband has a small penis complex? I didn't even know there was such a complex.
Well, again, it goes back to him being comfortable with himself. If he's not comfortable with himself and you're not comfortable with yourself, it's very hard to enjoy that experience together. Because if you're busy being excited and enjoying the experience with this person, and in the middle of doing what they're doing, you know, all of a sudden you remember, oh my goodness, we're in the middle of having sex and I'm having a great time, and, you know, I'm about to climax. Oh, by the way, I had just remembered what he told me a week ago about having this complex about his penis. You don't care at that point, you know, what's going on in his head, because you're at the point where you're trying to get to. You know what I mean?
Yeah.
And so you feel bad when you have males who have this issue, because guess what? God made everybody different. And that's the reason why some males go out and they get penile pumps and they do all these other things, because they're insecure with who they are.
Yeah.
But at the end of the day, you may be concerned as a woman about his penis being too small. There's another woman that would be very happy with the idea of his penis being small, because maybe she's suffered the same painful experience of being intimate with somebody else. So I'm not saying that anybody should go looking for anybody else's husbands or boyfriends or whatever the case might be. But I'm just saying we have to be comfortable with who we are and love who we are. Not everybody has large breasts. Not everybody has small breasts. You know what I mean? So it's the same thing. Not everybody is a size 2. Not everybody is a size 12.
Right.
So we just have to be comfortable with who we are and love who we are regardless.
Amen to that. And final question, I wanted to ask you a little bit about the testosterone, the men that are, you know, experiencing low T. And all of a sudden, I'm listening to the television while I'm working out last night, and I hear, okay, guys, if you're going to get all these low T things to make you have more testosterone, you can be causing yourself some prostate cancer.
There is an increased risk that's been reported of patients developing prostate cancer.
So why are you then getting the
However,
medication for the low T then? Why don't you just suffer with your low T and be cool about the low T?
But here's the thing. When males have a low T, their sex drive in many cases is decreased, their libido. So, you know, that causes issues for them. And in some cases, that makes them very depressed, because if they are not sexually stimulated and if they cannot perform for the person that they're intimately associated with, then that can create really big problems in their relationships. So in some cases, these males, you know, can do the shots, they can do the testosterone gel, and of course there's the O&P procedure that we were talking about last week.
Right.
So with the P procedure, you know, they're going after like the prepuce of the penis, which basically is that nice shaft area, that covering of the penis. You know, so they aim to introduce your own blood back to you. So the plasma portion of your blood, you know, they take blood from you and then they centrifuge it or shake it down, spin it down, and then that nice coloring on top, that pale red kind of coloring. In some cases it looks kind of yellow depending on, and then, you know, if people have high cholesterol, it might look quite different. But depending on, you know, the spin down, they're going to inject that into that male in order to stimulate their libido. So men are doing whatever it is because at the end of the day, they want to be able to please their partners.
Okay,
That's
so
really what it's about. At the end of the day, they want to please themselves, but they want to be able to please their partner, because a woman who is unhappy intimately, it's very difficult in many cases to capture her otherwise. If she's satisfied with every other area of the relationship, but there's a struggle in this particular area, that can cause a serious breakdown for the relationship, period. So that's a big deal for those guys.
it's a big deal for those guys, from Cialis to Viagra to all this kind of other stuff. But it just seemed to me that if, you know, the side effect is going to be something that scary as prostate cancer, then I would have to find something else. I'm sorry. If I were a guy, just speaking, if I were a guy, okay?
The biggest risk factor with prostate cancer is usually a family history.
Okay. All right. So
that's one of the big things to remember. Everything you take, there's an equal and opposite reaction.
Right. But so, that low T thing, when they advertise it, it's like, don't go near to the babies. Don't this. It just seems so, and if your wife is pregnant, and they have so many side effects that I don't know if some of these things are really even worth it. We should find another way to be satisfied. I think. Anyway, my special guest inside the program, the Diana Wright Show, live tonight at the 8 o'clock hour is Dr. Melanie Simpson. And Dr. Melanie, I'm going to give you a chance to just give your final thoughts before you go, because every time you're on, the hour seems like half an hour.
I know, that's true. It goes by very quickly.
Exactly, because we cover so much ground. I just hope that people, if you miss this show at any point, you need to go on and look at it, because crucial information. I know a lot of you are shy to call in or don't want to answer certain questions. What I do, I try to go online and find questions that people are asking in general and pull it, because I realize that that's what people want to talk about. And those are the questions that they need answered, but they're afraid to ask someone because, people figure, if I call in, they'll recognize my voice, something like that. So go ahead, final thoughts.
So I just wanted to say in closing that, I'm really grateful to the person that did call in. We appreciate your call.
Great information.
Feel free. We encourage everyone to call in.
Mm-hmm.
But I wanted to say, it goes right back to where we always started. I love me, I love me, I love me. I was looking at my T-shirt last night. I'm so
have you been wearing it?
T-shirt because April 30th came and went, May came and went, and now we're in the month of June. Yeah. But the love I have for myself has only intensified over those, subsequent months.
Yes.
And what I would say is, for a male, if you're tall, if you're short, if you have a large penis or a small penis, be thankful that you have a penis.
Mm-hmm.
There are men who have had to have, partial penectomies done because they've had cancer.
Mm-hmm.
You know what I mean? So be thankful for what God has given you.
Right.
The other thing I wanted to say is, do not believe for a second that having oral sex is not having sex. It is still intimacy that puts you at risk of some kind of disease process. The mouth is the dirtiest or most filthy part of the body. And then there's some people who don't like to brush their teeth. That's another day. However, that's something that we need to recall in our, in our everyday thinking, that the mouth is a risk factor for diseases.
Mm-hmm.
In addition to that, for those of you who are interested in birth control, please get sound advice. Don't, especially for teenagers that are out there, and I know they're out there, and I know they might be considering it, do not take advice from your friends. Go to your parents and have your parents take you to a doctor if you really believe that you really cannot do without being on birth control. Mothers and fathers, converse with your children. You will not know what they're doing if you don't ask, and if they don't want to tell you, you need to find a way to develop the kind of relationship where they will be open to you and be able to really sit down and have those kinds of discussions with you. And last but certainly not least, everybody does not need to go out and take an aspirin. Please consult your physician before assuming that it's okay to do so, because you never know. You might just be that 1 out of 100 who has a fatal event or an unfortunate event with taking aspirin. And especially if you're the kind of person that does not just pop one aspirin for a migraine or, a hand pain or a foot pain or whatever the case, don't doctor yourself. That's the reason that there are physicians out there.
Don't doctor yourself. That's a good way to end the program, don't you think?
Yes.
Okay, Dr. Melanie, thank you so much for joining us this week, and we look forward to having you next Tuesday again, where we can educate, stimulate, inspire, and educate everyone who's watching the show. Thank you so much. Have a great evening.
Thank you. You do the same.
All right. That was Dr. Melanie, my special guest inside the Diana Wright Show every Tuesday. My goodness, we have covered so much information this evening. Dr. Melanie gave you a roundup of the final things that you need to keep in mind, and I hope and pray that you listened. And as she said, it's the theme and the thrust of this program. I love me. It's so easy. Love is the biggest word on the planet. And all you got to do is take it, put that big word in the middle and put I in front of it and the me at the end, and you get I love me. And it is important for you to do so. I just want to keep you remembering April 30th, I Love Me Day. Come 2014. Did you hear what Doc said? She is having her t-shirt, making sure, looking at it, and remembering to love herself. Yes? So it's just a reminder. So you can go online and purchase one of the t-shirts, and even if you don't want to do that, that's fine. Just keep saying it to yourself. I love me, I love me, I love me. Men and women, children, and even your enemies, if you can teach someone else to do that, it would be great. All right? Also reminding you about October 5, when we're going to have a white fundraising party, courtesy of Save a Life Jamaica Foundation. It will be right here in West Palm Beach, and it will promise to be a fantastic night out for you to come and party, but you must wear white. That's why it's called a white fundraising party. Save a Life Jamaica Foundation is the foundation that's putting it on to raise money to help people with various problems around the world, not just in Jamaica. I guess Save a Life Jamaica Foundation just had a ring to it. So that's the reason Novelet Gale chose that name. But we are planning to not just help Jamaica, but help people around the world. Wherever the need is, we'll find a way to get to them, as long as you help us in our fundraising efforts, so we can have some money in the kitty to help the people when we get all these requests, because we get so many requests and we don't have the money yet to do so. So we're depending on you to do that. And if you can't make the party, of course, just go online and do what? Donate. Donate to Save a Life Jamaica Foundation. Thank you so much for joining me this evening. Tomorrow morning, it is Wednesday. So if it's Wednesday, it's Wellness Wednesday with Dax Dunn and myself. And we will be with you tomorrow morning at 10:30. So we ask you to join us then and have your questions about wellness, because it's important to be well, to lose weight, to be slim, to be at the weight that you desire for yourself, and to feel good about yourself. Because when you love yourself, all those things come into play. Have a great evening. And remember, if you love something, set it free. If it comes back, it's yours. If it doesn't, it was absolutely never yours. So, au revoir, adios, and ciao. Be blessed and stay prayed up, and join me tomorrow morning at 10:30 for the Diana Wright Show live.